So growing up, I was always caught up in between the summer heat of Limpopo and the whining sound of mosquitoes. Covering up always felt like a furnace. And whenever I tried to open up, I faced the risk of catching malaria. The catch-22 is real today for many Africans who live in extreme poverty with limited budget to afford aircons that can help to fend the parasites. According to the World Health Organization, in 2018, there were reported 213 million cases and 360,000 related deaths of malaria in the African region, accounting for 90% of malaria cases worldwide. The burden is heavier in the sub-Saharan Africa, where the majority of victims are children under 5 and accounts for 78% of malaria deaths. How come Africa accounts for 90% of world cases, yet we have medical breakthrough? We have antimethicillin-based combination therapies. We have no buzz by the African applied chemicals that are effective in treating malaria. The challenge is best summed by the video that I would like Kuda to play.
Old Grace Abba has malaria. For 2 days, her mother has been giving her medicine brewed from herbs and bark. Without proper treatment, she could get worse and die. Her mother has no choice but to walk the 26 miles to the nearest hospital.
Develop the best possible drug, but if the population has not access to this drug, then of course it will not have an impact on the disease.
I once had the former president of South Africa and the chancellor of the University of South Africa, President Beki, says, one of the greatest challenges for African growth is to contribute to the development of a shared agenda for the transformation system of higher education and to reposition the institution in the sector to play a more meaningful role in the transformation of Africa. If you observe the practice of leading institutions such as Oxford, MIT, Stanford, Harvard, you'll realize they are quick to respond to global challenges. For example, COVID-19 vaccine was pioneered by scholars in the UK, Germany, and in America. So how come malaria is still a bane in a continent, yet we also boost some of the leading scholars, some of the leading universities in the world? How can we reposition our scholars to also play a more meaningful role in the transformation of Africa? Universities are brewing pot of ideas. They're brewing point of experts. That is where insights necessary to develop tomorrow's innovation is. So what we have done with my students, Dr. Oluka and Mr. Ramuva, we've responded to the challenge of malaria by developing a mobile application that can help to increase access to stock levels. The mobile app connects the macro, the market, and the micro, governments, donors, suppliers, manufacturers, clinics, hospitals, and patients, so that they can have a better understanding of stock levels, where they are, what quantity, and where is the demand. After all, medicine is only effective if it's in the hands of those who need it. Today, we are piloting our application with our partner, the Ministry of Health in Uganda. We are also working with African Applied Chemicals to help them streamline the supply chain so that they can respond to demand in real time. Our efforts have not gone unnoticed. Last year, we were invited by the MIT to join the Global Solver Challenge, where we reached the semifinals. We also received first prize from the National Accelerated Program. I believe that if more scholars across all fields can go beyond publication, can take their research into innovation, Africa will have the solution it needs for its social, economic, and environmental challenges. Our universities are gold mines. Our research are sleeping buried. They are waiting to be discovered, to be realized. So let your research be the innovation that Africa needs tomorrow. Thank you.